Welcome back. Just in case you're tuning in now, our focus today is on NHIF cover and how important is it? Why do we all need it? And like we said, sometimes we live a very fast-paced life, and sometimes we don't really have time to think about our health. And in the event that an accident happened or you got diagnosed with a terminal disease, what do you do? In the sense that sometimes you do not have the money that you need to cover for all the hospital expenses. Then how about you think about NHIF? All right. Okay. And like we said, yes, we have a beneficiary and of course a representative from NHIF as well to help us better understand how important this cover is to all Kenyans and how about everyone gets it. So without further ado, let's welcome our guests for today. Good morning. How are you today? You're well?
We are well.
All right, karibuni sana to my doctor. The show is my doctor. Of course, we're honored to have you with us today. So we'll start with you. Kindly introduce yourself.
Yeah, my name is Innocent Ruria, and I'm a mother of two, a wife, and besides that, I'm a cancer survivor, a breast cancer survivor.
All right.
Yes.
Yes, we celebrate you with so many other survivors out there. I mean, October being the Cancer Awareness Month, so we celebrate you. Karibu sana. All right, and to you, sir.
My name's Gilbert Osoro. I serve as the manager benefits and claims at the National Hospital Insurance Fund.
All right. Karibuni sana. So
Thank
now, NHIF, I mean, we've seen the advertisements, we've seen, different people talk about NHIF, a beneficiary, she is here as well. But let's go back to the basics on what exactly is NHIF and who gets it.
Thank you. NHIF is a state parastatal, and it has the mandate of paying medical bills for Kenyans who are admitted in any of our facilities or who seek outpatient services in any of the facilities that are empaneled to NHIF. And for that matter, we have about 8,000 healthcare providers that have signed up contracts with NHIF. Yes.
All right. And so far, how many Kenyans have taken the cover?
We have around about 14 million Kenyans, including over 3.5 million students who recently joined, whom the government procured a comprehensive medical cover. In NHIF, we refer to it as Seko Afya. Remember, the government, when it was elected into office in 2017, the president, one of the things that he promised Kenyans was 100% attainment of universal health care. Actually, agenda number 4 was 100% attainment of universal health care. Towards that, the government has been increasing the length and breadth of healthcare services in this country. One of the things that the government has done is to expand health coverage by including people who are the poor of the poor through what we call health insurance subsidy programs, HISPs, reaching out to students in school. And that is why in April this year, the government enrolled over 3.5 million students in public secondary schools to the comprehensive health insurance cover that is administered by NHIF.
All right. Yeah. We'll talk more on the students as well as we progress with the show. But now let's talk to Innocent. Innocent, you said you are a cancer survivor.
Yes.
And above that, you are a beneficiary for NHIF. Yeah. So can you take us back on when you were diagnosed and what exactly happened? And when did you take NHIF and how did it help you in terms of covering for the costs?
Okay. Everything started on February 2012.
Okay.
I was just doing a breast exam when I noticed a lump in my breast.
Okay.
So I didn't think it was anything to be worried about. And I put off.
Okay.
So the lump did go away. I started feeling itchy. That was 2013. That's when I decided to go for a checkup. I went to Kijapi Hospital, and they sent me for the tests. I went to Mpisha, where I did mammogram. I did 4 times. They didn't see anything.
Okay.
So they opted to do the what do you call it?
Ultrasound.
And they saw that there was a mass in my breast. So they decided to do the FNA and core biopsy. And then I waited for 2 weeks for the test results to come out. And they sent the results to Kijabi Hospital. They didn't give me the results. So when I went to Kijabi Hospital for the results, there was the bomb. I had cancer. I had breast cancer.
Okay. At what stage was it?
They would not tell the stage yet. But when I did, then we did the, immediately I knew I had cancer. I stayed for like 2 weeks without knowing what to do. I was so devastated. But thank God, after 2 weeks, I recovered and I went back to the hospital where we booked surgery. Then after the surgery, that's when I knew I had stage 1 breast cancer, grade 2. So after the surgery, I stayed for three weeks to recover. Then I went for, they sent me to an oncologist at Kenyatta Hospital.
All right.
There, now the treatment began.
Okay.
I had to do 3 rounds of chemo, and then the veins went, I don't know where they went, so I had to take oral chemotherapy, and then I had to do 30 sessions of radio, and that's where the NHIF came.
All right.
Yes.
So previously, I mean, when you went for, the diagnosis and all that, you were using your own money.
Yeah, I didn't know whether they would help me on that. But when, on surgery, they paid for every day, the bed, the food. They didn't pay for the surgery that time. But for radio, they paid everything. 30 sessions.
All right.
Yes.
Okay. And let's talk to you, sir. Where, yes, we've had community health workers going door to door to register Kenyans, for NHIF. So how many would you say have registered? And then we'll go to now the types of membership and how, do you determine this amount covers for this particular service, either outpatient or inpatient, or in all the other services that have been introduced recently?
Thank you. There are quite a number of Kenyans who've joined up recently. And I want to salute Kenyans because we have received an overwhelming number of Kenyans who are interested in subscribing to our products. As I mentioned earlier, this year alone in April, when the students came on board, 3.5 new members came on board. We have an ambitious target that the government gave us, that by 2022, we are looking at enrolling 19 million members. You might have seen that we have moved aggressively. We've moved from our desks to go down to the grassroots to sensitize the public on the benefits of joining NHIF. We've partnered with county governments, and for that matter, we've rolled up universal health coverage in some counties. We're talking of Makueni, Nyeri, Laikipia, and Kisumu. We were recently in Kajiado and Kapsabet. And we want to go to the entire length and breadth of this country to enroll Kenyans to join NHIF. I want to borrow an analogy from the scripture that says that my people perish because of lack of sufficient knowledge. You realize that, as my sister said, initially she was not even aware that NHIF covers cancer. And I want to tell Kenyans, NHIF comprehensively covers for cancer. Among the packages that we administer in NHIF, and for that matter, we have 13 packages. Among them is inpatient cover, outpatient cover, dental, optical, free maternity cover, popularly known as Linda Mama, the surgical package. We have overseas treatment, and we take Kenyans who ordinarily cannot be treated in this country for further treatment in India. And among the conditions that many Kenyans seek treatment abroad is cancer. Remember, cancer requires advanced equipment. For one, detection. We are talking of a PET scan, which is a means of detecting the spread of cancer. We are talking of radiational treatment, whereby we are talking of linear true beam accelerator, radiotherapy, and for this matter, we are talking about the latest technology in the world, which is known as IMATI, and other interventional technologies like cyberknife, robotic arm, and others. We also have an emergency rescue service that we run in NHIF. In event of a road traffic accident, you can receive emergency treatment on location before you are taken to the nearest NHIF facility, and we say that there are above 8,000 facilities that are empaneled with NHIF. We also have specialized surgeries, and when we talk of specialized surgeries, these are organ transplants, kidney, liver, total hip replacement, total knee replacement, and others. We also have what we call for maternity, that is reproductive health, maternal health, and others. There are so many packages that we run. What I want to tell Kenyans that they can access our website or visit any of our NHIF offices, and for that matter, we have about 100 offices, or any Huduma center to access information pertaining to NHIF.
Okay, and when you talk about the special packages that were recently introduced, for instance, like cancer, in case of a road accident, other like kidney transplant and all that, how much percentage of the same does NHIF take care of, or is it, does it cover everything?
I'll go to the topic of the day, which is cancer. As I mentioned earlier, at NHIF, we have a cancer package. It's called the oncology package. Under the oncology package, it is divided into three. One, we have chemotherapy. And under chemotherapy, it includes the following. Consultation fee for the attending physician, that is the oncologist. There are those pre-cancer tests, and when we talk of pre-cancer tests, we are talking of blood tests. We are talking of full blood count, liver function test, creatinine. There are those cancer biomarkers which are used to identify the intensity of cancer. For men, we are talking of prostate-specific antigen, PSA. For breast cancer, we are talking of mammograph. There are quite a number of tests that people undertake. Those ones are covered. Then there's the actual chemotherapy. That is through IV, what we call cytotoxins injection to the body. And then there is medication for people who need medication, that is hormonal treatment, like Cash has been on hormonal treatment, tamoxifen. We do cover for that. What I want to tell Kenyans, there are quite a number of facilities that have signed up for our comprehensive cancer package. For example, if you are to go to Kenyatta National Hospital, whereby for first-line cancer under chemotherapy, it's divided into two. For first-line or basic cancer, we do pay for 25,000 shillings per session. And for first-line cancer, NHIF is obliged to pay for 6 sessions or 150, whichever comes first. For second line, now we are talking of complex cancer, secondary cancer. We cover for 4 sessions, and each session is 150,000, making it a total of 600,000. For chemotherapy alone, NHIF is obliged to cover up to a maximum of 750,000. For the other bit we cover under the oncology package, which is radiotherapy. That is a treatment through radiation. It is divided into two. We have the normal radiotherapy, whereby NHIF is obliged to pay for 20 sessions. And for each single session, we pay for 3,600, or a cumulative sum of 72,000. There is the latest technology in town for radiation. It's called brachytherapy. It's currently being offered at Nairobi Hospital and Cancer Care, formerly Cancer Care known as HCG. They have the latest equipment in town for brachytherapy. We do pay for up to Kenya shillings 72,000. For those. Yes.
All right. And back to Innocent. You said yes, you had the cover. When did you take it in Chaya?
1998.
Okay, so you took it in 1998. But during that period, before 2012, when you were diagnosed with cancer, did you at some point use it?
Yes.
All right, so you use it for other
Other
conditions,
yes.
but you didn't know that it would cover cancer.
Yes.
So you used your money at some point, and then what made you realize that, you know what, NHIF can actually cover cancer, and then you went ahead and used it?
Well, I heard from a person
All right.
who used the NHIF cover to pay for the treatment. So I asked the doctor whether he can assist. He gave me a form, and I went to the NHIF center to request, and it was cleared. I can use it.
You can use
Yes.
it. All right. And at this time, do you have to choose a hospital? Because most of the time, and I know recently where someone had to select a hospital where they want to go for the service. And if, let's say, you go to another hospital and NHIF, you know, they do not take NHIF, that is what they usually say, we do not take it. You have to use your own cash. So for your case, do you have to select a hospital for you to go now for the treatment that is covered by NHIF?
I just think I was lucky because I didn't choose the hospital at the moment.
Okay.
So from Kenyatta, I went and did the radiotherapy at Cancer Center, and they accepted.
Okay.
So
All right.
Yeah.
All right. Okay. And still on hospitals, because I've seen people and who are like, I went to a certain hospital and they say they do not take NHIF. So in that case, I had to use my own money. Or for her case, where she had to sort of like use her money at some point and then realized, you know what, NHIF actually covers this. So do you get some sort of refund for the money that you have used before? And then now we'll go to the hospitals where they're under 3 categories, that is A, B, and C. So you will also take us through what do they mean.
Yeah, let me start by, first of all, demystifying the choice of facility,
Right.
what you mentioned. As I mentioned earlier, that we run 13 packages.
Yeah.
Among the packages that we administer is the outpatient cover, which includes, among other things, general consultation, drug administration and dispensing, requisite laboratory investigations,
Okay.
annual medical checkup, and allow me to digress a bit on the issue of annual medical checkup. At NHIF, we realize that prevention is better than cure. And we are telling our members that matters cancer, that cancer can be contained if it's diagnosed at its initial stages.
Okay.
Personally, I've seen, my dad is a cancer survivor. He was diagnosed with prostate cancer in 1998. And today, he's still on hormonal treatment.
Okay.
What has kept him going is that we were able to note that there was a problem, and we sought high-end facilities where he was able to be diagnosed.
Okay.
We are telling Kenyans that in our cover, even the super cover, there is a clause for annual medical checkup.
All right.
And if you realize in countries that have succeeded, and I'm happy that Kenya has put UHC to be one of the key agendas that we want to achieve. Universal health coverage is preventive, promotive, curative, and palliative treatment. It is not investment in high-end, state-of-art equipment.
Yeah.
For other jurisdictions that have done very well, especially in issues cancer, it's through early detection and screening. And we were appealing to Kenyans to take advantage of this annual medical checkup,
Okay.
to periodically undergo tests. And we provide for the cancer biomarkers I mentioned. For men, prostate-specific antigen. For women, we provide for mammogram.
Mammogram, yeah.
And remember, even the ultrasound package that our sister was subjected to, it's covered under the radiology package, whereby we cover the MRI, CT scan, and ultrasound.
Okay.
What we are saying, for us to be able to harness the benefits of UHC, there must be a paradigm shift from clinical intervention to preventive and promotive healthcare in this country.
Yes.
Now, I'll go back to the issue that you had raised, choice of facility. For you to access outpatient services, it is a requirement for a member to select a facility of choice. And when we are saying a facility of choice, a facility that is convenient for you and your family to access. Remember, the payment mechanism for outpatient services is referred to as capitation. Under capitation, it is what I call block purchasing of healthcare services, whereby NHIF goes to a provider and purchases healthcare services for a segment of population.
All right.
And the segment of population must be defined at the time of purchase. That is why it is a requirement for Kenyans to select facilities of choice. Nevertheless, we also recognize that illness does not give warning when it's coming. We have also made provisions for emergencies, because there are also contingency situations whereby one requires urgent medical attention.
Okay.
Yeah.
All right. So someone might ask, in terms of contribution every month, how much do you charge? And do you categorize in terms of employed and self-employed, and how much does one contribute every single month?
Thank you. That's a very good question. In NHF, the package we administer is divided into two categories.
Okay.
Under tier 1, which is the national scheme, popularly referred to as the super cover.
Okay.
It covers people in self-employment. And when we say self-employment, these are people who've employed themselves, Juakali artisans, talking of fundis, mama mboga, and other people. It also covers people in formal employment who earn between 1,000 Kenya shillings and above. The provisions of the NHF Act, Section 15, which defines the eligibility criterion, states that any Kenyan who has attained the age of 18 years and whose total income is such as prescribed by the minister in consultation with the board, and in this case we are talking of anybody earning over 1,000 shillings, shall be a member of NHF, and shall is mandatory. So anybody who has attained that age and whose total income is above 1,000 is eligible to be a member.
All right.
For those in self-employment, as you've asked, the monthly premium is 500 shillings per month.
Okay.
And ours is a family-based cover. And when we say it's a family-based cover, it includes, among others, the principal contributor, his declared spouse, and declared children or dependents. It's important, Kenyans, to realize that you must be declared, because we've had instances of members seeking services, and yet the principal contributor has not declared them into the system.
Okay.
So they have to be in our database for them to access services.
All right. And do you have like a specific number, like of dependents? Like this is a maximum number of dependents that we can cover?
Thank you. That's a very good question. At NHF, we realize that children are a blessing.
Yes.
We do not put a limit on the number of children that you can forward to our system, subject to you proving beyond reasonable doubt that these are your children.
Okay. And in terms of declaration, like this person declares the principal contributor and then now the dependents, how soon are they supposed to do it? Especially, let's say it's the husband who has, let's say, NHIF, or the wife. How soon are they supposed to put the names, or suppose the lady is pregnant and they do not have, the children are not there yet. So, and like you said, they need to declare, the number of dependents on the same. So how soon are they supposed to do it, and what's the procedure for the same?
Thank you. Declaration of dependents should be at the point of application for membership.
All right.
Remember, as I mentioned earlier, illness does not give a warning that you'll fall ill. So we encourage our members at the point of registration, you need to declare your wife or husband and their children. What is required for you to capture them or to put them in our system? For example, if you are a spouse, you need a photocopy of the ID of the spouse, marriage certificate. For children, you need a copy of a birth notification for children under the age of 6 months. For children who are over the age of 6 months, we need a copy of the birth certificate.
Okay. But what if they're not legally married? Like they're not, they do not have the certificate, but they're married. Like the come we stay or something happened and they have to, to be together. So they do not have the certificate to say we're married. What about them?
The provisions of the law were amended last year, whereby the government passed the African Customary Law Act, and it's very clear that for a marriage to be recognized, there must be a declaration which is captured within the confines of the law. So for any other arrangement like come we stay, it will be difficult for us to recognize you in our system. Because it's a requirement of the law that one must have, even for African customary marriage, that one must register
Okay.
He's a union.
All right.
Yeah.
So okay. So for such a person, what do they need to do? Do they need
The AG gave leeway, and he gave, I think, he provided a window period for people to regularize their marriage. Because again, we realized that a number of people had not, did not have any instrument of the law to recognize their marriage. When the act came into force, he provided a window of 18 months for all those people who are staying together to come and register their marriage in the nearest Attorney General's Chamber's office or in churches.
Okay.
Yeah.
All right. So we need to take a very short break, but of course, when we come back, we also want to understand the categories A, B, and C. What exactly do they mean? And suppose, for example, for the self-employed, something happens and I'm not able to make the monthly payments, like the 500 shillings every month. What do I need to do? Can I access the services as well? So we still have so much, to discuss as far as the NHIF cover is concerned. But just in case you have any other question in regards to the topic, or 791-478990 is the number to call, and of course ask any question in regards to the same, and you will get your answers immediately. So we're taking a very short break. We'll be right back with more. Stay with us. Right, welcome back. Just in case you're tuning in, this is My Doctor, and today our focus is on NHIF cover. And during the first session of the show, of course, we talked about who can get the cover, and the answer here is all Kenyans need to get the cover. And of course, if you are self-employed, then you would need to pay 500 shillings. That is, if you earn a salary of 1,000 shillings, then every month you will pay 500 shillings. And of course, for the employed, there's a special the way that the deductions are done. Of course, we'll talk about that. But just in case you have any other question in regards to the same, then feel free to call us live. The number is 0791478990. And of course, we'll answer all your questions in regards to NHIF. Now, let's talk to you, Innocent. How many sessions did you have to go for chemotherapy? I'm pretty sure you mentioned this during the first session, but of course, just take us through how many sessions of chemotherapy, how many sessions of radiotherapy, and how much percentage was covered by NHIF? 6
sessions of chemo.
Chemo, okay.
And 30 sessions of radio.
All right.
Yeah.
And how much were you supposed to pay for each?
For each, it was 25,000 radio. I mean, chemo.
Chemo, yeah.
And radio, I think it was 7,000 per session.
Okay.
Yeah.
Are there any other services that you had to seek, and how much of it were covered by NHIF? And how are you doing now? Are you still, like he talked about hormonal, yes, are you still on it, and is it still covered?
Yeah, the hormonal therapy is covered. Yeah. Every month, I take every day a tablet for 24 hours, and they cover for that. They also cover for every 6 months, I go for checkup, and they cover for all those tests. They cover for them.
That you go for.
Yeah.
All right. And as a cancer survivor, how much would you say this has helped you? Because if you look around, and just based from the calculations that you've given, 25,000 shillings per one chemo session, all right? That and of course, not forgetting now the radiotherapy, which when you look at it, it's very, very expensive. It's very expensive. Of course, we all know that cancer treatment is expensive. Amongst other, conditions, they're very expensive. And like he said, sometimes we're not prepared for it. It doesn't warn you, like, you know what, I'll be coming in the next 2 months, so be ready. No one, gets a warning on the same. So how much would you say you have benefited from the NHIF services?
Benefiting very much from it, because since they started covering my treatment, every month the hormonal therapy is like 1,500 shillings every month. Okay. So they pay for that. And so far I've done like three MRIs, and it costs over 40,000. And they covered for it, everything.
Okay.
Yes.
All right. So it's more, would you say that it has...
It is very helpful.
Lifted so much burden from you. All right. Do you have dependents, and how many are they, and how are they benefiting from the same?
I have a husband and 2 children.
All right, still on the cover.
Yeah.
All right, okay. Now let's talk about, in terms of, yes, we talked about the different categories, that is the employed and the self-employed. And for the employed, how much do they contribute? Do you, or what do you factor in terms of the deductions that are made every single month? And what of, in the event that someone loses their job and they're not able to continue paying every single month, what happens to them? Can they still access the services?
Okay, thank you very much. For those in employment, formal employment, their contributions range from 160 to 1,700. And it depends on the income you earn. Anybody who earns below 6,000, 5,999 contributes 160. There is a graduated table which tabulates on what one should contribute.
All right.
So the maximum being 1,700 per month. Now, in event of the unfortunate circumstances, one were to lose his job, you can still continue to access services. What one needs to do is to visit any of the NHIF branches, and I said that we have about 100 offices, or any Huduma center, whereby you need to complete an amendment form. And among the details you'll indicate is that you've ceased being in formal employment, and now you want to amend your card to self-employed, whereby you'll be obliged to pay 500 shillings per month.
All right.
You'll still continue enjoying our package. Yeah.
All right. And then also you sort of make it like you're self-employed.
Yes.
All right. So continue making, so that you do not enter into the defaulter
Yes.
page or the defaulter, session where what will happen if someone defaults. You would need to answer that. But for now, there's a question, and someone asks, does NHIF cover IVF?
Let me tell Kenyans, yes, because it covers, but for those under comprehensive cover, I want to be very clear on this.
Okay.
I said earlier that we do administer 2 types of tires, and I said tier 1, that is the national scheme, popularly known as the super cover.
Yes.
Under super cover, we do not cater for in vitro fertilization or IVF.
Okay.
Now, we do also administer tier 2, which is now what is referred to as corporate schemes or enhanced comprehensive cover.
Okay.
These are entities that have subscribed to a comprehensive cover.
All right.
You are talking of civil servants, national police and Kenya prisons, government parastatals, public universities, private entities. And their premiums are over and above what the people under the national scheme contribute.
Okay.
Under the corporate schemes, we do cover for in vitro fertilization. Yes.
Okay. All right. And let's say someone does not fall under tier 2. You said those ones are the ones that maybe can get the cover for IVF. But so someone does not fall in that tier. What can they do to maybe access the service?
Because under tier 1, we do not provide for IVF unless they subscribe.
Okay, to the second tier.
Yeah, enhanced cover.
Okay.
Yeah.
All right. Now, in the event that someone loses their job and gets into now the defaulter, part of it, what do I need to do to make sure that I clear my name and get back to the good books?
If a member were unfortunately to lose his employment, at NHIF we've made provisions for the member to regularize his contributions.
All right.
As I said, what you need to do is to go to the nearest NHIF office, amend the status of your contributions from formal employment to self-employment, whereby you will be contributing 500 shillings per month.
Are there penalties for maybe they say, like, let's say I've not paid for a certain period of time?
Yes, yes. If in event you remit to make contributions, because the provisions of the NHIF Act number 9 of 1998, Section 18 provide for penalties, and the law is very clear that all premiums due to NHIF must be paid before the 9th of the following month. So any payment that is made after the 9th of the following month attracts a penalty. For people in self-employment, the law states that they will pay a penalty equivalent to 25% of the contributions that they were to make.
Okay.
So not 25, actually 50%. For people in self-employment who are supposed to remit 500 shillings per month. In event of default, they will pay 250
Okay.
as penalty accruing from making late contributions.
Okay.
But that is only payable if the period of default is not more than 12 months or 1 year. In event that you have failed to remit contributions for more than 12 months, then you will have to start afresh, whereby you will make payments of 3 months or 1,500. The card will have to be restricted for a period of 60 days or 2 months, whichever comes first.
All right.
Within these 60 days, a member cannot be able to access services
Okay.
until the card matures.
Okay.
Yeah.
All right. Okay, that's a good clarification, because someone might be like, maybe I lost my job or something happens, maybe in self-employment, and then maybe in the event of an accident or something, I am not able to go back to, you know, the kind of life I used to live, and I'm not able to make the payments. So what will happen? So it's good to make that clarification. All right, let's talk to you, Innocent. In terms of, because someone might be watching us right now, probably they do not have the cover, and they're like, so what do I need to do to get the cover? And then once I go to the hospital, what happens? I tell them that nkona NHIF, and then what happens? So you, of course, being you know, a beneficiary, and that the fact that you use it every day, can you tell us just briefly on the procedure once you get to the hospital? What exactly happens? Do you have to sign a form?
Yes, there's a form.
All right.
You tell them you have an NHIF cover. They give you a form, you sign, you fill. Alafu hiyo form unaenda nayo kwa daktari.
All right.
So whatever prescription you are given, the doctor has to sign. Ndio ikienda kule ikuwe processed. But you live there with the medication and everything else.
Okay.
Yes.
All right. And support, because I know of someone who has NHIF, yes, and then went to a certain hospital, but the kind of services that he required were not available in that particular hospital, so they had to refer him to another hospital. So in that case, do they have to start all over again, or do they get like a referral letter, let's say, from a doctor in this particular hospital, referring them to a different hospital?
Thank you. It's very important. Remember that there is a national referral guideline that is spelled out by the ministry, whereby in event that you cannot access specialized services at your primary health care, there is a provision that is made for you to get services, either being referred to a consultant. At NHIF, we recognize the national referral guidelines, and we are eligible to cater for expenses arising out of your referral.
Okay.
Yes.
All right. And you also talked about students,
Yeah.
you know, accessing the cover. Just take us through how that works.
Yeah, thank you. Remember, the president, when he was elected into office for his second term, promised Kenyans 4 things. And one of the key things that he promised that will drive his agenda was 100% attainment of universal health care.
Okay.
And when we are talking of UHC, UHC implies that the greatest proportions of Kenyans can be able to have access to quality, affordable, accessible health care that promotes preventive, palliative, curative healthcare services.
Okay.
Towards that, the government is working overdrive to ensure that the greatest proportion of Kenyans have access to healthcare services. The government rolled out a cover, or procured a cover for all public secondary school students in April this year. The cover is a comprehensive cover, just like the corporate scheme that we rolled out for civil servants.
All right.
It has, among other things, inpatient, outpatient, optical, dental, radiology, oncology, overseas treatment. It provides for emergency rescue services, and under emergency rescue services, it provides for both air rescue and the road rescue. At NHIF, we have a comprehensive cover agreement with the Kenya Red Cross Society through a program known as E+, whereby in event of a road traffic accident, and you are a member of NHIF, you can call the toll-free line, that is 1199, and Red Cross will dispatch an ambulance to the nearest location of the accident, whereby our member will receive first aid treatment and transport to the nearest NHF accredited facilities.
Okay.
So for students, we also cover for drug and substance abuse. We realize that substance abuse is a serious problem in this country. We also cover for guidance and counseling. Yes.
All right. And for university students, so who makes the payment? Is it the parents? Because again, I want to believe that, let's say for the high school students and the university students, they are on the list of the dependents from their parents. So are they the ones who make the payments, or is it covered in the
For
school?
the Seco-Afia, that is the cover that the government procured for public secondary schools. The premium is paid by the government of
By the
Kenya.
government, all right,
Yeah.
okay. So what they need to do is just present the card and...
The arrangement that we have with the Ministry of Education is that, remember, all students who are put on what is known as NEMIS, the National Education Management Information System, which is a form of unique identification for every student.
Okay.
The ministry gave us data of all students in public secondary schools, that is the NEMIS number, which we uploaded into our system. Yes.
Okay, all right. And for the dependents, still, how long does it take for them to now access after being added to the plan? Because I know of someone who, yes, during childbirth, the child was not added to the list of dependents. So they were not, in terms of the services for the child, were not covered by NHIF. So only the mother, received the services that she received were covered by NHIF. But for the child, she was not added at the point to the cover. So how long do they access the service after being added?
It is important for us to declare our dependents at the earliest opportunity. Immediately one joins the cover. In the event you've been blessed with a newborn baby, it's incumbent upon the parent to either visit the office or any Huduma center with a copy of either the birth notification or a birth certificate for him to update the system. I want to say something about your friend. What could have happened perhaps is that they had sought medical services, but the child was not declared in our system. And as such, the child could not get services. But we are saying, even if you have not declared, you can go to the nearest NHF office with supporting document and it will be uploaded into our system. What I like to tell Kenyans is about the spouse. In event you've been blessed to get a spouse, it's incumbent upon you to go to the nearest NHF office and declare the spouse, because there is a window period of 28 days, before the card matures for the spouse to access services.
All right.
Yeah.
All right. So for the spouse, 28 days, then they will be able. And for the child?
Immediately.
Immediately. Yeah. All right. Okay. And then we talked about the contracts with hospitals and graded into A, B, and C. So briefly take us through, what does A, B, and C mean?
Yeah, in NHF, we've categorized hospitals into 3 categories. Under category A, these are government facilities. When we talk of government facilities, we are talking of the apex facilities like Kenyatta National Hospital, MTRH, and others. We are talking of county facilities. For example, Kisumu County Hospital, Nyeri County Hospital, Kisii, and others. These are facilities whereby our members walk in, receive comprehensive services without paying a single cent. They are fully comprehensive. Under contract B, we have faith-based institutions. And when you are talking of faith-based institutions, what comes into mind are facilities like PCA Kijabe, Consolata in Nyeri, AIC, Tenwek, Mata, and others. These are facilities that are owned and run by faith-based institutions. They've also entered into contracts with NHIF for provisions of comprehensive medical services. On the same note, there are facilities that are private that have also subscribed to the comprehensive cover that is rolled out by NHIF. Under contract C facilities, these are high-end premium facilities. We are talking of Nairobi Hospital, Aga Khan, Karen, MP Shah, and other facilities. These are top-notch facilities that are privately run, but have signed up contracts with NHIF on agreed terms.
All right. So in terms of going to whichever facility that you want to, do you have to consider first, let's say, the type of member that you are and the contributions that you make in order to ascertain which facility offers the kind of service that you're looking for?
Very true. A member needs to be wise to select a facility of choice because, again, we remember these private facilities, they charge top dollar. So it depends on the depth of your pocket. You must make an informed choice where you can access services. For us, we have contracts. For example, for inpatient, if you were to go to one of these high-end facilities, we pay 4,000 per day, but we realize that some of those rooms, they charge up to 20,000 per night. In NHIF, for us, it's the curative aspect. It is not the hospitality that you get in the hospital. And when I say hospitality, it's not the leather seats, the TV, the newspapers you get. For us, it's the clinical intervention that we cater for.
That you get for. All right. And for Innocent, because I've had people say that, I was watching one guy and he was saying that he went to a certain facility, wanted, and the doctor recommended that X-ray be conducted, and the facility did not have the machines for the same. So he had to go outside, get the X-rays, and then come back to the hospital. And you see, when they go out, chances are they might not get the cover outside. So they have to use their own pocket. So do we have arrangements for the same where people can get all the services in the hospital? But now, before you answer that, let's talk to Innocent. You talked about the different times that you had to go for radiotherapy and chemotherapy. And sometimes, because of a lady who, suffered like complications after and the side effects. So what would you say was your case? And in the event that you also had to go to the facility and ask for help for the side effects, were they covered by NHIF?
Well, for the side effects, I didn't have any.
All right. Oh, you didn't have any. Oh,
yeah,
wow.
I thank God for that.
All right.
But they cover for the side effects because those are like the lymphedema. When you have the surgery, maybe probably the hand or the leg will swell, and they go for physiotherapy, and they cover for that.
Okay.
Yeah.
And in terms of accessing all the services that you need as an individual, have you ever had cases where, let's say, you wanted a particular service and it was not available in that particular hospital?
Yes.
What exactly happened?
Well, when I went to Kijabi, they didn't have the mammogram, so they had to send me to Mpisha.
All right.
But during that time, I didn't know whether they can cover for the mammogram.
Okay.
But now I know better. Whenever I go for mammogram, I go direct to Mpisha and they do it.
All right.
And the NHIF covers for it.
Okay.
After the doctors have signed the form.
All right.
Yeah.
So you have to sign the form first, and then the doctor, looks at it and signs, and then you get the services.
Yeah.
All right. And in terms of getting the quality of service, because like he said, it's all about the curative aspect. It's not about the hospitality or the kind of services that, let's say, the extra curricular, I would say, that you get offered in a hospital. What would you say in terms to let's say, that Kenyan who's watching us right now and thinking, well, every month I have to contribute, and then again, when I go to hospital, probably I do not get the services, all the services that I need. What would you say to them, having that you are the beneficiary of NHIF and a cancer survivor? Talk to all of them right now watching it.
Well, kwa wao, I would say walipe the NHIF, not to be on arrears, sababu when you get on arrears, you'll get penalized, and when you want to use the card, you can never use it, because you have to chip back to your pocket, uweze ku clear the balance. And when choosing, kama mimi nimechoose yenye iko huko kwetu, inaitwa Rimuru Nursing Home.
All right.
Ndio iko karibu na mimi. Mtu achuzi ile anaona itamsaidia kabisa.
All right. And what made you choose that particular one?
Sababu iko karibu na mimi.
All right.
In case of anything, nakimbia hapo na nasaidika.
Okay. All right. But then again, we have to consider that some facilities that do not open 24 hours.
Yes.
So in the event that something happens, let's say at night, and someone is not able to access that particular facility, what would you say to that in terms of now making the informed choice on the kind of facility that you select?
Me, I think that it depends with the person. Wherever you feel you are comfortable ukienda kutibiwa, you just choose that which comes in your mind yenye unaona utasaidika zaidi.
Okay.
Yeah.
Now, as a beneficiary, talk to us comprehensively on the amount of, what would you say, the in financial burden that you would have incurred during the process of your treatment compared to now all of them that have been covered by NHF comprehensively. How would you say it has helped you? Because so many people out there, like we said, we're not warned in case anything happens, and when they do, so many people, you'd find that people have to sell a portion of their land, they have to sell some of the properties that they have to make sure that at least they can afford a particular service, and sometimes you're referred to a high-end facility where you have to even pay more. So you as a beneficiary, talk to us comprehensively about the benefits of joining NHF.
Well, like he said, there is a package yenye wanapeana kwa every let's say like kama ni cancer patient, there is a package they pay for. So kulingana na mimi naona imenisaidia zaidi because like every time I go for a checkup, apart from the consultation, hizo zingine zote wana cover.
Right.
So if I go for blood tests, the mammogram, they pay for that. Apart from that, every month I go for hormonal treatment, hormonotherapy. Now the tablets they give me, and they don't charge. They pay for the treatment.
Okay.
So inasaidia sana, and I would urge every mwenye anaangalia aweze register kwa NHIF kama he or she is not registered, and it'll help.
Okay.
Yeah.
All right. And of course, on that note, unfortunately, we have to end the show. But thank you very much to both of you for coming over today, and of course, just helping us understand how important NHIF is. Because, like we said when we started the show, sometimes we're too busy. I mean, life is, we're sort of stressed. I mean, wake up in the morning, go to work. We don't really have enough time to ensure that we live a healthier lifestyle. So if you could have something that will take off or take care of the burden in the event that something happens, or you fall sick, or you get into an accident, then it's better to do it, and that is by taking NHIF. So we have to say goodbye. My name is Winnie Lubama. Thank you so much for joining us. We'll see you again next week on Monday for another episode of My Doctor. But for now, it's a goodbye from us, and enjoy the rest of your day. Goodbye.